up the health budget to 15% and launching the universal health coverage are among the top key promises made by the Kenya Kwanza government in its health manifesto. 1 year down, the line sector has witnessed its fair share of transformations and challenges. In this special report, our health and science reporter Zainab Mohammed analyzes the performance of the Kenya Kwanza administration in the health sector vis-a-vis the promises made in their manifesto last year. Take a look.
William Samoei Ruto.
When the Kenya Kwanza government got into power on September 13th, 2022, its manifesto for the health sector was full of promises, with the UHC rollout making it to the top of its agenda. A year down the line, the advisor of the Presidential Economic Transformation Team on Health, Dr. Daniel Mwai, says even though the rollout is yet to happen, the government has been setting up the right infrastructure and legal framework for its implementation.
We have failed twice. We cannot just say it's 1 year, let's learn, or the government has come in, we just implement without addressing the challenges that the other regimes have actually faced that have made health provision become a difficult thing to achieve.
Among the key changes necessitated by the rollout include the overhaul of NHIF and transformation into 3 new funds.
Tunarudisha sheria ya NHIF bunge. Vile tulikubaliana na nyinyi ya kwamba hiyo NHIF ilipwe kulingana na kiwango ya mapato ya mtu.
The government has also drafted 4 key bills for the implementation of UHC. The bills, namely Digital Health Bill, Facilities Improvement Bill, Social Health Insurance Bill, and Primary Health Bill.
Where we had structured the earlier system, you'll find that those facilities were not having the right commodities, and therefore people would move away to go to seek care far away. So in trying to address that, that is why we have the registrations.
The 4 bills that are currently ongoing a public participation exercise have had both positive and negative reception, with the government urging Kenyans to welcome them with open arms.
That is a move in the right direction. But I think what I have said is that what we are seeing are the first steps. And what will determine success is the steps that are going to be taken going forward, and inclusivity in making these decisions.
Further, in its plan to transform the country's healthcare system from curative to preventive, the government unveiled 100,000 health promoters to strengthen primary health care. This, however, has stirred numerous reactions among health workers.
We must be very keen and cautious to ensure that we do not give them more than they can chew. I have seen some attempts to even give these health promoters the responsibility to treat, to give them some antibiotics, to treat some injuries. And this is a lay person. These are lay person in the community.
And despite the many positive transformation underway, some promises have seemingly been overlooked, including the hiring of 20,000 health workers and scaling up of the health budget to 15% as per the Abuja declaration.
The establishment of KHH-LAC, which is a council that is ideally looking into those issues continuously, is happening now, is one of the ways that we are able to move to first understand not only the gap, but how do we address the gap? Because there's a promise, and there is the method of achieving the promise.
The challenges being witnessed in the health sector are being felt by the government as well, with the new strategies facing significant resistance from key players in the sector. Kenyans, on their part, have expressed mixed reactions on the government's performance in the past 1 year, some welcoming the new changes, while others urging the government to pull up its socks.
Zile sheria ambazo zinapendekezwa za mambo ya NHIF, kwangu mimi naziunga mkono, kwa sababu ukiona mtu ambaye anapata pesa mingi, yeye anastahili kulipa zaidi, na yule ambaye anapata pesa ya chini anastahili kulipa pesa kiwango cha chini. Hiyo ina balance mwananchi ambaye ni tajiri na yule ambaye ni maskini.
Hiyo mambo ya hospitali tunaona kweli inaelekea kuimarika, sio mbaya, lakini tunataka iongeze kabisa. Hiyo tumeona ni sawa kabisa.
Ni vizuri serikali iwekeze katika afya, iweke mikakati ya kutosha, kila mtu asikose dawa, ama wasiweke wakaweka chemistry yao wawe wakitumana kwenda kuchukuliwa madawa huko.
Going forward, Dr. Mwai says Kenyans will begin witnessing the fruits of the transformation in the coming years. Zainab Mohammed, T47.